Great. So my name is Samuel Munyuwing. I work with the African Institute for Children's Studies. I want to welcome you, especially Karibu Sana. This is a special session for us, and I'll give a very brief background of who we are. African Institute for Children's Studies is a non-profit organization, Pan-African, and when we started off 12 years ago, we had the intention of building capacity of experts in this continent who will be able to address the quality of life for children in terms of programming. We influence that in research, in policy advocacy work. We also influence that in how we do our programming. We've tried to link together the academia and practitioners because often that is missing link. And so we've organized international conferences. A lot of them so far focused on child protection. But we have experts in all the thematic areas, and our broad ones are health thematic area. So we have experts on health. We have those from the education sector, those in protection sector and social development, and youth empowerment issues, governance issues, gender issues. So it's really across board. And in this kind of a platform, this kind of a forum where then we're able to provide information to build capacity, I believe it helps us have a pool of experts across the continent and even outside the continent who can be able to then do a better job out there. So we're very privileged in the first of our series of capacity building interventions that we'll be doing online, that we have Dr. Vicky Doyle and Emma Kelly. I'm going to read a brief of their profiles, and then I'll allow them to also say a bit more about themselves. They're both working with the Capacity Development International. So Dr. Vicky Doyle is not very new in Africa. I think she's done a lot of work here. She's a UK-based health development professional. She has over 25 years of experience in working on research, education management, and consultancies. So really, she brings in all that, and I think is a great benefit. She's designed and delivered evaluation, health projects and programs for communities at district level, at the national level, in terms of health system in the sub-Saharan Africa, in Asia, and Latin America, both working, she's worked with governments, with the UN agencies and global health partners, research institutions and consultancy companies and NGOs. So really, she brings in a lot of experience that all of us are in. Her research and consultancy work in health systems focus on strengthening quality improvement in healthcare, strategic planning, capacity development, and evaluation, has resulted in contributing to global guidance and national strategic documents, policy briefs, training manuals, book chapters, and journal articles. Vicky is also the director of studies for the Liverpool School of Tropical Medicine postgraduate certificate program in the International Health Consultancy. So exactly the subject we'll be talking about. This she did between 2008 and 2019. Vicky, welcome. Karibu Sana. We really look forward to you downloading all that experience in a few minutes. Welcome, Emma Kelly. Emma is an international health consultant with 25 years of experience in working in public and global health. In the last 8 years, she has focused on developing and implementing complex evaluation strategy, toolkits, resources, research and development proposals, and think pieces for a wide range of research, development, and humanitarian actors. Her ability to think conceptually, use systems thinking to understand the interaction between technical and management aspects of organization and programs has resulted in a unique contribution to the design of robust organizational strategies and evaluations. They together also run a 3-week program on trainings on this. So I'm sure at some point they'll be able to tell us this. And in Kenya, they've also worked with LVCT Health. Vicky has done a lot of that. I think I see colleagues from LVCT Health here. Dr. Lilian Otiso, I see Joseph here. You're welcome into this. Vicky, over to you.
Okay, thank you very much for the introduction. Great, and thank you for such a nice introduction. We're going to try and impart some knowledge, give you some stories, and give you a taste I think a taster, because I said normally myself and Emma, we run a 3-week certificate program in international health consultancy, and we've got about 40 minutes to talk to you today. So we're going to give you a flavour. I hope it will excite you and perhaps could lead to something more in the future in terms of how we could deliver this kind of training in perhaps more innovative ways. What we would encourage also, if you do have questions whilst we're presenting, please put them in the chat and we will try and respond as we go along. We will also leave time for questions at the end. So yeah, please feel free to, any questions that you have as you go along, just please post them in the chat and one of us will respond. So yes, we are going to give you a taster today, the art of establishing yourself as an international consultant. So first of all, let me just tell you a little bit about Capacity Development International. We are UK based in Liverpool. We set ourselves up in 2012. And when I say we are a sort of boutique consultancy company. That's myself and Emma. And one of the reasons we set ourselves up was we're passionate about strengthening the effectiveness of technical assistance, whether that's research, development programs, educational programs. And we do this through strategy development. We do rapid mixed methods evaluations, tool design. We've done a lot of bespoke training with mid and senior level health professionals, and we support program design and implementation. So I've been very privileged to work with LBCT over many years now in supporting program design and implementation in quality improvement and in community health system strengthening. As Samuel already mentioned, we developed and delivered the LSTM, the Liverpool School of Tropical Medicine Postgraduate Certificate Programme in International Health Consultancy. So we have trained literally hundreds of health professionals from around the world in the quest to produce stronger, better, more robust consultancy. So I was very excited, Samuel, when you were talking about trying to really develop this pool of experts, because I think this is what is needed. And these are experts who are regional experts, local experts, international experts. We need them at all levels. And we need people who can get that different experience working with different donors, different types of health systems and different conditions. And just here on the slides, just some of the clients that we've worked with, and I'm sure many of you will be familiar with some of these. Next slide, Emma. So what we'd like to do in our very brief whistle-stop tour of international health consultancy, we're going to talk about what is consultancy and what do consultants do. We're both going to talk about our personal journeys because they're very different, how we both got into international health consultancy, and I think that's quite interesting. And we'll talk to you a little bit about our company and so how we've managed to, it's like 9 years on now and it's still going strong, so that's really good. And that's just as a small consultancy company. So we're going to talk a little bit through that, and then Emma's going to talk about surviving as an international consultant and is this a viable career option? So just a smattering of things to get you hopefully a little bit more hungry and wanting to learn more about consultancy. So next slide, please. So what is a consultancy and what do consultants do? There have been many critics of consultancy. Often consultancy is seen as something that is donor-led rather than being led by clients. It's often, the scope of work is often short-term focused and not so balanced on what's required in the longer term, looking at that sustained capacity development. Often the terms of reference is very poorly written. Often the wrong questions are being asked. Sometimes it's viewed as being very expensive. People often see it as being, consultants only tell you what you already know. The quality of consultancy delivered can be very variable. And consultancy reports, often they're poorly written. They have unfeasible recommendations, they're overlong. These are some of the problems, but then also there are some very good consultants out there doing very excellent work. So we want to talk to you really about what is consultancy at its best and what consultants can do. So next slide, please. So when we talk about what is consultancy, it's the definition from a core competency framework for international health consultants. They describe it as the provision of expert advice, analysis and interpretation, which draws upon and applies the knowledge, skills, techniques and equipment of the consultant to meet a specific external need. So really, what I would say, in other words, the essence of consultancy is about adding value. That's what your job is, often people are bringing you in because they're stuck on something. They want a problem to be solved. You need to come in and add value. It's about providing this objective expert advice, analysis and interpretation. And this will often be based on your broad experiences across different contexts, but very importantly, using the best available evidence to help the client. And I think this is really important. It's that being client focused to attain their goals and solve their problems. One of the problems we do have though sometimes is that clients aren't always sure what the problem is, and you may have to work with them to help them really further refine and focus. What is it that they actually want to achieve? What are the goals? And then you can work together in finding those problems. I think also one of the things to warn about here is that often when you're bidding for consultancy work, there is often an excessive focus on your technical knowledge. And what both myself and Emma would argue, it is often those soft skills which are more important, those skills of coaching, mentoring, facilitating change, that practical experience of how do you achieve results in short time frames, being a good listener, being able to use and apply participatory approaches, including the right stakeholders. And I think very importantly, often in the academic world, we kind of hold our knowledge to us tight. This is ours and this is our copyright and we're going to publish it. Whereas I would say in consultancy, it's that willingness to share your knowledge, your expertise and your experience. So these are some of the very important things. So even though often it's having the good qualifications will win you the work, it's often those softer skills which are going to be more important to make you a good consultant. Next slide, please. I always like to show this. This is from the World Economic Forum. They talk about the top skills that you need. And they do a big survey amongst industry. And if you look at the top 10 skills of 2025, a lot of them are around problem solving. And I would argue that a lot of these are the kinds of skills that you need to develop, you need to sharpen to be an effective consultant. It's that analytical thinking and innovation, complex problem solving, critical thinking and analysis, creativity, originality and initiative. They also talk about self-management. And again, this is incredibly important, especially if you're working as a freelance consultant. And so it's that active learning. How do you keep yourself abreast and up to date? And also resilience, stress tolerance and flexibility. And I think particularly during the pandemic, I think consultants have been really tested on how do you still work effectively as a consultant when perhaps you're not allowed to travel. Certainly myself and Emma, we had to switch halfway through an evaluation from being in country to turning it all online. And we literally did it overnight, bam. So you've got to be very adaptable and flexible as well. Working with people, this is so important as a consultant. How do you develop those people skills, those influencing skills, those leadership skills? A lot of what you're being asked to do is looking about how to bring about change, or building other people's capacity to be change makers. So you do need to, I think it's really important, thinking about yourself and whether you're already doing consultancy or wanting to step into consultancy, to think about what are the skills that you have, what are your strengths at the moment, what are your weaknesses, and how could you develop those skills to make yourself a really effective consultant. And this is a grid that myself and Emma put together some time ago. And it's really about sort of, some of the different ways you can develop your learning. And like we've got these, I suppose, the more traditional forms, which is like continuing professional development, academic study, online courses, self-directed study. But I think there are a lot of other ways we can learn. We learn through action learning, we learn through networking, through consultancy, through volunteering, sitting on steering groups, putting ourselves into new roles and projects, doing self-reflection, working in multidisciplinary teams. There are many different ways. So think beyond the conventional when you're thinking about how can I develop my capacity? How can I develop those skills? How can I make sure I really fine-tune those top 10 skills for 2025? And just think beyond those more traditional or conventional forms of strengthening your capacity. Next slide. So consultancy opportunities, there are lots of opportunities out there. And so donors would typically fund a range of work. And this could be from doing feasibility design studies when they're deciding whether they're going to fund something, to a situation analysis or options appraisal. Then there can be when you can be called in to actually design projects or programs. There may be work to manage or big programs, so program implementation. It could be individual tasks within that implementation. There's often a lot of training, consultancy in training, design and provision, in research, doing desk reviews, to be a technical advisory group member for your specific expertise. A lot of work in program and project evaluation. Myself and Emma do quite a lot of this kind of these complex mixed method rapid evaluations, and often that ends up then leading also into some strategic planning or strategic thinking work. And I think with these consultancy opportunities, there can be short-term, medium or long-term. So certainly the work that myself and Emma do, we do a lot of short-term work, and often short-term intermittent, where we might work and support an organisation with short inputs over a period of months or even years. And I would say that my working relationship with LVCT Health in Kenya has been very much like that. Short-term input, but over a longer period of time, so you can really develop capacity as you go along. But also there can be medium-term positions, there can be long-term where you may be actually based on a project full-time. So there are lots of different ways you can do consultancy. Next slide, please. And how they are utilised. And again, I think here they can have very different roles and functions. Sometimes you see consultants are being pulled in to do gap filling. So that's literally where local capacity is considered inadequate. And I think if you do one of those roles, be very clear whether it's gap filling or whether you're there to close the gap, to build capacity of someone else to do that job. So be aware of whether it's gap filling or gap closing. You may be called in just for specialist advice if you're tackling a specific policy or operational challenge where you're bringing in expertise and experience which isn't there within the country. It may be to diagnose large or complex organisational problems which are often too overwhelming for an organisation to handle alone, and they need that expertise to come in. A lot of work, I would say, is in capacity development, and this is a lot of the work we do in strengthening partner capacities, looking at skills, systems, and policy frameworks. Sometimes consultants are brought in when it's implementation of difficult or sensitive solutions. Also to influence or inform policy agendas and reform programs, and also often in that project management role when you're managing complex donor funding, procurement, planning and reporting. So consultants can be used in a very wide variety of roles and functions. And I think for yourself, it's really thinking about, well, what are the kinds of roles that you're comfortable with? Do you see yourself as a kind of an expert, as a facilitator, as a mentor, as a coach, or perhaps you can wear several of those hats, but it's important to be thinking about the different ways you can support as a consultant. Next slide, please. So what we'd like to also talk you through very briefly is our personal journeys, because I think, as I said, both myself and Emma have quite different personal journeys. So I'm going to talk you through my one, then I'm going to hand you over to Emma, who will talk through hers. So mine was a bit more traditional in that I did a PhD in health systems within the UK context. And already I was building my capacity skills, learning about research design and implementation, learning about qualitative and quantitative research methods, presentation skills, writing skills, networking. I then joined the Liverpool School of Tropical Medicine as a research fellow. And I think, yeah, that's where I started really getting that exposure, working in a different international contexts. And I was very privileged to work in Latin America, in Asia, in sub-Saharan Africa. So again, I was sort of developing my cross-cultural communication skills, my networking, and my technical skills, and kind of finding my niche as well, really. Well, what is it that I can really deliver? What is it that I can do that perhaps makes me stand out from other people? I then, and actually this is building on one of your points earlier, Samuel, I was very passionate about kind of getting, how do you get sort of, things working in practice? So I moved away from the academic more into the technical assistance side, and I joined the Liverpool Associates in Tropical Health, which was the technical assistance wing of the School of Tropical Medicine, and I was the director of technical services there. And that's, I think, where I was doing a lot more mentoring junior staff, proposal writing, writing large kind of multi-part, putting together large multi-partner consortia, writing very large bids, managing large programs. And so more in a management role there, having to learn a lot about how to influence and negotiate when you're working with some of these big commercial consultancy companies. But then at the same time, I was trying to have a family. As a woman, I had 3 children, and then I thought I have no time for my family at all. And so I decided at some point, right, I need to actually take a little bit of time out. So I thought, well, let's work as a freelance consultant. It was a risk, but it was a risk I was willing to take because I wanted to get a better work-life balance. So I then set up as a freelance consultant and did this for several years, but I was able to leverage on my existing networks, maintain good relationships with the School of Tropical Medicine, and to consolidate again my teaching skills and also refocus back to some of my technical skills because I've been doing a lot of management previously. And then a couple of years later, Emma decided she was ready for a change, and so we set up Capacity Development International. I'm not going to talk to you too much about that because she's going to actually talk to you a little bit about CDI in a minute and how we've sustained that. So I think, with my personal journey, it was very much, what I was passionate about really being able to apply, to develop I was developing lots of different skills, and I was very passionate about how can you actually make a difference. And so that was really taking that, moving from academia into technical assistance and looking at, and for me, what excited me was building other people's capacity and trying to work with them to influence policy and practice within their own countries. So next slide. So just a few personal reflections then. I think, for me, it was the reason my career has been the way it is, I think, was I wanted to do things which made a difference, but I wanted to be able to balance my career with my personal life, with my family. And I think I've managed to do that fairly successfully. I think one of the things which I think has been really important is, I felt stifled by the institution. I think having our own institution has been very liberating. Where in general, we tend to work with people we like working with, doing projects which we believe in. So keeping that passion and energy for what we do. I would say working in consultancy, we're continuously learning all the time. If you're someone who likes to stay in your comfort zone, don't be a consultant. Ideally, you want to be in your stretch zone, and you want to minimize the amount of times you're in that panic zone, which sometimes does happen. But you want to try and keep yourself in that stretch zone where the whole time you've been stretched, you're challenging yourself, you're continuously learning. I think, getting the balance is always a difficult thing. And I suppose it depends on about how much income do you want and how much work and how much sort of time with your family you want. And that's going to be down to personal choices. And I think the other key reflection from me is you really have to have a heart for sharing, sharing your knowledge and expertise with others. That's, good consultancy is all about that. So I'm going to pass you over to Emma now, who's going to take you on her personal journey, which I said is very different from my own.
Thank you, Vicky. Okay, so I have come through a kind of less traditional route really to the type of consultancy that I'm now doing. My background is really mainly in management, and I was in a range of senior management roles, ultimately at Liverpool Associates in Tropical Health, which is where I met Vicky, and we worked together on various things while she was still working there. But some of those senior management roles that I had were very much about managing consultancy. So I had a significant experience in identifying consultants from CVs and matching them to consultancy assignments, in reviewing TORs from clients and deciding the mix of the team that we were going to put forward, in reviewing bids for consultancies, and these were both, I mean, my experience in bidding is both for small consultancies and then also for the same kind of multi-million-pound complex programs, large programs that Vicky was talking about before. And then also managing the reports that came in and reviewing those reports, making sure that they read well and making sure that they actually met the original client's expectations in terms of those terms of reference and what the client needed. And so I have a large experience of managing consultancy and also managing large development programs with a specific focus on capacity strengthening. And then I also would do capacity strengthening activities, both within our organisation and our partner organisations as well. And I had a passion for capacity strengthening. I enjoyed management, but I decided that it was time to do something different. And so at the point where the organisation was going in a direction that I didn't particularly want to go in, that's when I decided to jump, and we set up, Vicky and myself set up Capacity Development International. And at that point, I had very limited consultancy experience. I had experiences of managing projects, I had experience of delivering some projects, but not really consultancy experience. And at that point, we bid collectively for consultancy, and we were able to really stress the complementarity of the skills that we brought. And so I wasn't having to rely solely on my CV in order to win work, because we were doing it collectively as the two of us. And that worked very well. And then after a certain number of years, suddenly my CV was full of consultancy experience. And I can now describe myself as a very experienced consultant. And Vicky and I have kind of developed different, you know, we're still quite complementary. Although we work together a lot, we have complementary areas that we work in, and we have like our own areas of specialism. And now, you know, we still predominantly bid collectively, but sometimes, you know, we have projects that we do individually as well. And so, you know, again, you can move into consultancy without having necessarily that traditional route that everybody thinks about. So some of my personal reflections about what's really worked and what has enabled us to kind of like build the consultancy profile that we've got. One is the way in which we use frameworks and we use evidence a lot within our consultancy. So although we are doing consultancy and not academic work, we take a lot of the tools from academia and use them within our consultancy work. And that means that we can show that the work that we're doing is robust, it's evidence-based, it's objective. We also very much pride ourselves on using analytical skills and being quite analytical. And that's not only in the work that we do and deliver to the client, but it's also in the way that we bid for work as well. So we'll be analytical at the bidding stage as well. Communication's absolutely crucial. You know, being able to work well with clients. And part of that is also a very professional approach. And that professional approach is about how your CV looks. It's about how your bid looks. It's about how your report looks. It's about how you communicate with people. And you know, it should flow all the way through what you do. And these have been very important in building a portfolio of work. So looking at us as an organisation rather than individuals, some of the key things that have helped us sustain as a very small consultancy company, one of the key ones is networking. And I think that when you're taking that first steps into doing consultancy, it's highly likely that some of your first clients are going to be the people that you've already been working with. And so, you know, you need to leverage those networks first. And so, you know, Vicky, I know, you know, being a freelance consultant, She did a lot of work with people that she'd worked with already within the Liverpool School of Tropical Medicine. She had already had very strong working relationships with LVCT Health as well. And so those were networks that she could leverage in terms of getting initial work. Another aspect I would say is that one of the things that we've been very successful in is that we have a very high, what's called a hit rate. So that's the number of bids that are successful over the number of bids that you put in. So if you have 100% hit rate, that means that you win every single bid that you put in. Ours isn't quite 100%, but it's actually not that far off.
Very close.
And there is, you know, we talk about the art of being an international health consultant. There is an art to how you bid for work, and also positioning yourself for particular size work that maybe the big firms aren't going after, but you can maybe, if you band together one or two of you, you can put in a better bid than people who are going on their own. Equally, if you're on your own, you can put in good bids because sometimes you can be more cost effective. So it's just about finding whatever that niche is, but doing really professional bids and thinking about what makes you stand out will really help, has really been a very big success factor for us. The other one is delivery. If you deliver a poor product, then certainly that client will never ever use you again. They will also probably talk to other clients who will not use you. And so, you know, your reputation is extremely important as a consultant. And that means that you have to be aware of what the client wants, keep talking to the client if things are becoming difficult, don't leave it till the end, and make sure that you deliver a really good product to them. The other thing that is, you know, we're both passionate about, and we could do a whole session about, is the ethics of consultancy as well. Okay, so just coming back to networking, this was a survey of 10,000 consultants on how they market their services, and the thing that they spent the most time and the most money on was networking. And then the next thing after that was referrals. And I think that that's, you know, it's just absolutely true. You know, the way in which we have built our business is very much, a lot of it has come through networking. And then we've also benefited from referrals. And then for us in particular, then there's also this thing of actually being good at actually putting your bids together as well. So, surviving as an international consultant, is this a viable career option? So we're just going to touch on a few issues here. So firstly, do you need a niche? And I think Vicky's already put some thoughts about this in the chat. Yes, you do need a niche, but your niche can change. You can have more than one niche. And you can have a niche which kind of means that you're a good generalist as well. So, you know, one of the things that Samuel was reading out about me is about, you know, my ability to kind of like be quite analytic and bring together kind of technical and managerial. That's not a very specific thing, it's quite a general thing, but it also is a niche. So your niche doesn't necessarily have to be something very specific. But what you're wanting to do is to make yourself stand out. And it is that thing, you know, I would sometimes for one position review 100 CVs. What is it that you're going to write in that CV that makes me think that you're the right person for that position? And so you do need to be really, really clear about what your particular strengths are. And what you can bring, and then try and look then at how you can match that to what clients are actually looking for. So where do you find work? We think there are kind of like a few different ways in which you find work. There are reactive opportunities. So this is where somebody's published a call for proposals, or they've published a TOR or a job position for a consultant, and you basically are responding to those opportunities. Then there are more proactive opportunities. So that is your networking. And part of networking is maybe, you know, asking people what's going on. When people tell you that maybe they've got particular problems going on, you could then talk to them about how actually that's something that you've dealt with previously, and this might be an approach they might want to think about. And doing it in a way where you're being helpful and not giving them the hard sell. So not saying, oh, well, you absolutely need me. If you pay me this amount of money, I'll come in and sort you out. It's much more about having that dialogue and about having a problem-solving approach, and then letting people like ask you to come in rather than you demanding you to come in. Developing new programs or training, you know, you can actually proactively develop something and then try and sell it to the right person. Building strategic partnerships so that when people have a new project coming up, they think immediately, well, yeah, absolutely, we need to have Capacity Development International involved in that because they're really good at doing this and we need them on this project. And then marketing yourself. So website, big business card, CV, LinkedIn, Twitter, all of those things are about marketing yourself. Your CV is absolutely crucial as a consultant. And if you're responding to a job position or a bid or anything like that, then it's absolutely crucial that you tailor your CV to that particular opportunity. The words that they're using in the call, you need to reflect those words within your CV so that they can absolutely see that you match. And again, that's CV writing is something that, again, we do a whole session on within the training that we do. You can also register your CV with consultancy companies, with donors. They often have a bank of people that are on a database. And you also should register on the kind of websites of organizations that you might hope to work with, so that when they do have an opportunity, it pops up in your inbox. However, I would say about registering on databases is that, you know, if they haven't worked with you before, if you're just a CV, then they won't necessarily just automatically pick up the phone and offer you some work. You know, they're more likely to offer people work that they've worked with before. And so actually going and knocking on people's door, meeting with people, and then responding to opportunities, making sure that those CVs are tailored is probably going to get you more work than just hoping that it's going to arise because you're on a database. So one of the things that you need to reflect on before you start on your journey as a consultant is thinking about, is this going to work for me? And it's a very personal thing. You need to understand how much income do you need per annum to keep the roof over your head and your family fed. You need to think about who are your likely clients going to be and what fee rates do they pay, because fee rates vary massively. And so you know, we can't just say to anybody, this is the fee rate that you will earn. It just does not work like that. Then you need to think about, well, that, you know, given that that's the likely fee rate that I'm going to get, how many days that rate gives me the income that I need. Is this realistic? Often if you're doing short-term work, you might be working only about 100 days per annum that are paid days. The rest of the days you're probably still working, but they're not paid. And so, you know, some of those days are going to be doing your business development, your networking, your writing of the bids. And then you need to think about how much risk you can take at the stage of your life that you're thinking about this. And remember that you'll be responsible for, if you're sick, if you need maternity leave, you're going to be responsible for paying in for your retirement. You're going to be responsible for managing if your client doesn't pay you on time. So how can you manage these things? And sometimes what people do is they dip a toe in the water. So what they might do is go down to part-time work and negotiate with their workplace that they can do this kind of flexibility and working that allows them to do consultancy. It is a juggling act to be either a freelance consultant or a small consultancy company, because you're having to do a lot of things at the same time. You're having to market, you're having to network, you're having to bid for the next bit of work, often at the same time that you're having to deliver a really cracking big piece of work for whoever your clients are at the moment. And at the same time, take care of that, reviewing what you do and keep on learning so that you just get better and better and you give value to your clients. So marketing yourself, a consultancy CV is different from an academic CV. It should be concise and focused. We usually say 2 to 3 pages at the most. It should have a skill summary. That's a bit of written text at the top. It should clearly identify the skills and experience the client is looking for. You should put selected consultancy and projects over jobs. You put your jobs in, but towards the end and not too much detail. You don't have to be complete. You don't have to put everything. It's the selected ones. And there's less emphasis on publications, conference attendance, trainings attended. It demonstrates your communication skills. If I got a CV and it had 3 typos in it, it went on the reject pile instantly. So yeah, I can't tell you how important it is to just have it laid out nicely and proofread. Sometimes, you know, and this is something that I have done previously, you could be selected for a position solely on the basis of your CV, and that's why it's so important. So it needs to work independently of a covering letter or an interview. And again, as we said before, needs to be tailored. So one of the things about being a go-to consultant, yes, it's about your capabilities and qualifications. It's partly about people will look at who your previous clients are because that enables them to trust you. Just like when you employ somebody to come and work on your house, you may well want to know whether they've worked on other people's houses and whether they were happy with the work. It's the same kind of thing. So those references and testimonials. People who have personal experience and enjoyed working with somebody or found their work useful will often go to them again. So you often get follow-up work. So it's about building confidence. It's definitely about professionalism and ethics. It's about building trust, but also enjoyment. You know, people will go back to working with people that they enjoyed working with as well. And it's about making sure that you take up and create opportunities. And so, you know, when we do evaluations, we always see it as, you know, these evaluations are not about looking back. They're about looking forward. They're about an opportunity to grow. They're an opportunity to do something differently. And absolutely, it is about that delivery, getting that delivery right, pleasing your client, even when you've got difficult messages to say to them. Okay, so just a few words on fee rates. Basically, often consultants are paid on the basis of being either a national, regional, or international consultant. Now, the definitions that we think should be used are that national consultants have only worked professionally in the country that they're doing the consultancy in. Regional consultants have worked professionally in more than one country within the same continent or region, and international consultants have experience of working in more than one continent and is able to apply learning to different contexts and contextualize that learning. Now, we see in reality that these definitions are not always followed by people who pay fee rates. And so sometimes somebody, by my definitions, would be an international consultancy, an international consultant, but they're paid as a national consultant because they happen to be doing the work in the same country that they're actually from. And that should not be the case. So fee rates vary according to whether you are defined as a national, regional, and international consultant. They also vary according to your experience and education. So sometimes on some projects we used to have like a table that would say the maximum and minimum fee rates. And you know, if you only had a master's degree and not a PhD, then you'd get only up to a certain amount of money. And if you had a PhD, you could get more money and things like that. That doesn't always happen, but that is the case in some cases. And I've also seen things where it's, you know, up to 5 years experience, this maximum, up to 10 years experience, 15 plus. It massively varies on the client, and clients will, you know, sometimes they will publish information about their fee rates, but quite often they won't. And so you often, one of the best things that you can possibly do is just ask other people who work for those clients and ask them what fee rates they're getting, and hope that you get the ones who are willing to share with you what those are. As I've said before, part of all of this then has to feed into your income planning and deciding whether or not you can actually get the fee rates that you want to get. So just to carry on with this a bit, so fee rates vary between funders, they vary between specialisms. Some specialisms are in short supply and get higher pay. Also the level of risk of where you're actually working. So if you're willing to work in fragile states, or you're willing to work somewhere which is currently in a state of unrest, then it's likely that you will get a higher fee rate. Usually costed on a daily rate for short-term consultancy and some long-term work, although long-term work you might be getting more of a kind of salary type package. But it can be costed also as fixed price contract. So sometimes if you want to do a really strategic piece of work, but it's quite low fee rates, you might just say, okay, I'll do the piece of work, I'm going to charge you $5,000 for the whole thing. And then you don't get into the you know, exactly what the fee rate is. And that can be important because there are some clients like USAID where they want to find out what your fee rate history is. So that means that if you've negotiated it as a fixed price contract without a daily rate, you don't have to put that in as a low daily rate. Long-term consultancies might have additional benefits like relocation allowances, accommodation, etc. For short-term, if you're having to travel, then you're going to get a whole raft of subsistence and travel allowances as well. And again, some people are more generous with those than others. If you go through a company, they will add more money onto your fee. So obviously they're going to try and negotiate you down. If you can go directly to a client, then obviously you're not having to have that markup on, and you can maybe get a higher rate. However, if you go through a consultancy company, they'll also manage a lot of the work for you. Our experience is that fee rates have been static or reducing over the last few years. You also need to check various things about travel days, weekends, overtime. Usually for consultancy, it's a daily rate. It doesn't matter whether you work 21 hours or you work 7 hours, you're just going to get that daily rate. And, you know, travel days, quite often some people will pay them. Weekends, very much depends. Payment terms, when are you going to get paid? That's important for managing your money. You need to know that. And, you know, make sure that you are aware of the distinction between fee rates, which are paid for the days that you work, and your daily subsistence allowance. You might get more days because you might be paid for weekends where you have to be there, but you might not be working. So in summary, why choose consultancy? Well, we would argue that when consultancy is demand-led and uses the best available evidence to inform decision-making, and when the people doing it are qualified, committed, ethical, and effective, it can be highly rewarding and can make a difference to individuals, to institutions, and ultimately even to whole systems. So with that, we would like to open up to questions, and I can already see that there are a few questions that are currently unanswered in the chat. So let me just take those. Yeah, so Lillian is asking, how are you able to assess the time the work will actually take to avoid underestimating the time demands? This is something that we're actually not that good at still. We always seem to undercharge. We always do more work than we get paid for.
Being a perfectionist.
Yeah. I think that sometimes as a consultant, there can be an inevitability that there will, you know, you're actually going to spend more time than you are actually getting paid for. I think that there's an element that's an inevitability. However, I think as you get more experienced, you understand like where things take time. And then it's partly about how you sell that to the client. So when we bid, there are things that we might break down into a lot of detail. So for instance, if we're doing interviews, we'll say, well, it's this amount of time to arrange the interview, this amount of time to conduct the interview, this amount of time to transcribe the interview, this amount of time to analyze that transcription. So if you break it down, it's then quite hard for the client to say, oh, well, we don't want you to actually transcribe the interview. And it's like, well, then we can't do the work, you know, so doing that can be quite helpful, but it is partly experience. But I think as well, trying to imagine the whole process in your head, you know, what is it that you're going to have to do at each stage, and make sure that you are actually costing that in.
Yeah, I think also, Emma, one of the other points, I think when, sometimes you get given a terms of reference where it is just unrealistic. And it's really important to, at that point, to sort of kick back and say, and then sort of, give the argument and say, actually, in our experience, when we've done previous evaluations, if this is the level of detail you want, it's going to take this long. And so I think sometimes if you're in that position where you can kick back, it's good. It's also, if you're doing a long-term piece of work, having regular briefings with the client. And if you think then it's going to take, there's no guarantee you'll get more days, but I think if you're having regular communication with the client, you can sometimes also sort of, raise some of these issues as well. So again, having that good rapport with the client and regular communication is always very helpful. There's no point waiting to the end of the consultancy then crying and saying, oh, it took me twice as long. They will not be sympathetic in the slightest.
No.
Yeah.
And then I think Joseph was saying, how do you balance between charging too high and losing the job, and charging too low and underselling yourself? And Vicky's already said, good to find out what the market rate is, and absolutely. And if you can ask the client, do they have a ballpark figure in mind? Some of them will tell you, some of them won't, and if they do, then that's useful, because then you've got an idea of what you're aiming to. Yeah. What I would say is that what I would tend to do sometimes is maybe charge too few days, but the right fee rate, rather than charge a low fee rate and the right number of days. And the reason being is that the next time you do work for that client, you're at the right fee rate. So you can then try and negotiate the days well. But if you have already done work for them at a low fee rate, it's quite hard then to suddenly jump up to a much higher fee rate. They're unlikely to take that. So you're always better to reduce the number of days to something that maybe that it's a bit too few, than to reduce your fee rate. Do you have agreed international rates or any references? We will try and find anything. Some of the resources that we used to share on our course are a little bit out of date now, so we'll try and find if we can find some updated versions. Sometimes what you find is that the European Union have these things called framework contracts, and they often publish the fee rates that are used within those framework contracts, so they're quite useful for actually getting a feeling for a bit of the market. But again, as I say, it just varies so much between contexts and particular clients. Are you working directly for some of the big donors? Are you working for NGOs? It's just going to be wildly different. Some clients will pay lower fee rates, but then will pay more generous per diems as well. So you also have to balance that up as well. So it's, and I do think it's asking around, your colleagues who are also doing consultancy, to try and share with them. The more you can share with each other, then the better idea you've got of what those market rates are. Not everyone's willing to, but I think the more, if you've got a trusted network of people you're working with, then you can ask. Definitely. Yeah.
Any more questions? Because we've got literally 3 minutes left, I think. Although there's already some requests for CV consultancy writing training.
We can definitely do that. Yeah.
One thing we would like to send out a questionnaire actually later. We wanted to wait till after this, where we were going to say, look, these are the different areas, and because we are quite interested in looking at how we could develop the kind of consultancy skills training we were doing at Liverpool, but as either an online version or a blended learning option in sub-Saharan Africa. And this is something we want to explore in a bit more. So we're going to send out a questionnaire with asking you a few more questions about that and what your interest would be.
Great. I was going to say, if there was time, you would have given us what are the broad areas, but that will come in the questionnaire.
Yeah.
What are the broad areas of training that you
Yeah.
offer? But thank you. I think this is really, really insightful. Personally, I take home, especially the having an annual income plan, because the risk is usually to keep taking every other consultancy that comes. Eventually affects my reputation, and yet, you know. So I think that balance is very critical, knowing I need 100 days of work in this year. I can try and secure that and say that's enough for the year. But I also see a benefit in working as teams, like you've mentioned.
Absolutely.
The emerging issues, one of the most recent work I saw is a call to do a research on the impact of COVID on access of sexual reproductive health for girls in school. So you almost see a health expert, a gender expert, an education expert.
Absolutely.
So working as teams then comes in with a lot of benefit.
You can put a very powerful application as a team. I think.
Exactly.
Yeah.
Exactly.
Never be afraid to do that. We've been very successful in doing that.
Yeah, and I mean, one of the things I would say about that is one of a very powerful way of bidding for that type of work is to take all of the things that the client says that they need and present your expertise combined together against each of those headings. So rather than saying Samuel is this, he brings this, that, and the other, Vicky is this, she brings this, that, and the other, you say, okay, they're looking at gender. Samuel has done this in gender, Vicky has done this in gender, and that's a much easier way for the client then to really know that you're meeting exactly what they need.
Yeah, you have to just tick every box, so they just cannot not offer you the job. But as we said, though, you need to be in your stretch zone, but you don't want to get into the panic zone where you've got so many pieces of work and you'll become overwhelmed, you can't deliver. So it's that fine line. You don't want to be in your comfort zone because you can go stale, you can get bored. You want to be in that stretch zone where the whole time you're being pushed a bit, but not when you get into that. Yeah, maybe now and again you might be in the panic zone for a tiny bit, but you don't want to be in there for too long.
Exactly. Great. Well, thank you very much. We are on time, and we've asked you to register, so hopefully we have your contact. We will let you know in the next session.
We'll send our PowerPoint to you, Samuel, if you can then make sure that goes to everyone who's registered.
Exactly. Thank you for that.
Right.
Great. So I think that's what we can manage today. Thank you so much, Vicky. Thank you, Emma. Thank you for sharing your lives. We look forward to more opportunities to learn from each other. And I invite many of you to be associates at AICS. I'm happy, as many of you, creating your own consulting firms in small teams, and because the more we are with great capacity in the continent, the more we can inform decision making in the continent. So I appreciate this.
Okay, thank you very much.
Thank you for the opportunity.
Kwaheri. Bye-bye.
Goodbye.
Bye.